A study conducted by the Human Sciences and Research Council has shown that South Africans were willing to sacrifice their right to stop the spread of the coronavirus during the lockdown period. The findings of the research, titled "Who is Willing to Sacrifice Human Rights in the Context of COVID?" were released during a webinar in Pretoria. Now let's discuss this. Of course, we're joined via Skype by Professor Narnia Bohler-Muller, the Executive Director of the Developmental, Capable and Ethical State Research Division at the Human Sciences Research. Thank you so much for joining us.
Thank you. It's a tremendous pleasure.
All right. Please give us the background of the study.
Well, we were hit by the pandemic and we didn't even know what was coming. But we did know that we needed to do some research from a social science perspective. And therefore, we partnered with the University of Johannesburg Center for Social Change in order to do a survey on how people were experiencing the lockdown, because it's very important to know that the medical stuff is important, the technical stuff is important, but people's perceptions and beliefs and opinions are as important. So we ran a survey from April of 2020 all the way to the beginning of January of 2021. But we had 3 rounds. So we had a round in April, May, we had a round in July, August, and then we had another round at the end of December, beginning of January. And the question we asked was, would you sacrifice your rights in order to stop the spread of the virus? So it was a very specific question related to what COVID was about and what they were people were prepared to accept under lockdown.
So during that time, there was a time when people really panicked about the spread of the virus, and specifically whether they were going to die or those who were close to them were going to die. But the main issue of contention also became whether or not they wanted to get back to work, because some of them felt that they were very constrained in terms of movement and income. So how did the research address that element of panic when you were doing this inquiry?
You know, South Africans were very fearful. And we found that in the survey right at the beginning, levels of fear and stress were very high. But as the virus and the lockdown proceeded, these feelings of fear, depression, and sadness actually decreased. And I think that might be because people got used to the situation. But throughout the lockdown period, 2 things remained very constant: that people were prepared to sacrifice some of their rights, and this included the right to go to church or mosque or synagogue, to travel from place to place, to go to school and university, and also that the trust in the president was very high throughout this period.
So when it comes to risk tolerance, the reports that we've heard before, other people were very wary of staying home, especially when lockdown regulations were eased, where we saw people that they were not observing social distancing, not having face masks. And when we had the country going to level 2 and level 1, that's when we saw the spike of infections and all that. So with the objectives of looking at how people were willing to sacrifice their human rights and the extent of risk, complacency, and flat-footedness that we saw in December, how did you address that matter?
Well, complacency was really creeping in around that time, especially since it was the holiday period. And I think there was a time where people were showing irresponsible behavior, and that's why the survey at the end of December indicated that 78% of the South African population would be prepared to comply with regulations, even if it did lead to them having to sacrifice some of their rights, such as moving around or going to a religious observance. So people do take it very seriously. We're a very resilient country, And it seems as though we become a lot more compliant since the second wave. You know, our survey was done kind of when the second wave was just starting. But if you look around now, you can definitely see that people are taking mask wearing and social distancing more seriously than they did before. Well, that might also be because you can get a criminal record for not wearing a mask, which may be something that needs to be addressed because one certainly doesn't want to have a criminal record for life. But we are facing low numbers at the moment. Compliance may be an issue again with Easter coming. And therefore, we may be facing a third wave. There has been talk about that. And there has been some talk about going back into lockdown level 2 before Easter.
So does the element of leadership and the representative views of pressure groups regarding, 1, the issue of smoking, 2, alcohol consumption and sales, and you mentioned also the right to go to church and public events. Does this research reflect the aspiration of what organizations were advocating for? And was government responding adequately regarding its stance and also the court appearances where these matters were battled out?
Well, we didn't really, the survey was very much question-based. So, but there were some qualitative questions that people answered where they could say what was frustrating them the most about this lockdown. And we couldn't get an indication as to which organizations were lobbying or what was happening there. But people were very, very clear that they were most unhappy about alcohol and tobacco. And that did go to court, and some of it was resolved and some of it wasn't. But that is very interesting because, to run to court about those two issues, but not perhaps around food parcels, was surprising. But it seemed to anger a lot of South Africans across the board.
Right. Thank you so much for making time to speak to us about this research on human rights during the lockdown.
Thank you very much.
All right. We're speaking here to Professor Narnia Bohler-Muller, who is a developmental, capable and ethical state research head at the SABC.